Good morning. I'm coming to y'all from the Texas EMS show this morning. I've got Jeff Latham. He's the president of Traumatec Incorporated. This looks like a very cool product, literally. Tell me what we've got here.
Well, basically what we have here is a brain cooling device. It's non-invasive. You can also do any kind of patient temperature management with the device. You can warm the patient or cool the patient's brain. And basically what we do is we cool the patient's brain basically 1.5 degrees C per hour. And some of our research at University of Miami Trauma Center has shown that we have outstanding effects of cooling the brain efficiently and effectively. And also additionally, we can control the patient's pain levels by setting the temperature where it's comfortable for the patient as well.
What's so important about cooling the brain? I see in this you have the golden hour.
Yes,
Explain that to us.
The golden hour. Well, basically in any type of scenario with cardiac arrest, stroke, traumatic brain injury, we have various things that are holding us back from being able to treat the patient. There's so much trauma going on. And one of the things that I came up with for cooling during the golden hour was going out with paramedics and seeing what we needed to do at the scene, inside cervical collars, inside splints, to be able to begin the cooling process to bring rehabilitation to the scene. And so as a therapist at a trauma center working with patients with therapy models up in the hospital, we wanted to bring therapy out to the paramedic level so that we begin to slow down trauma as it comes into the ER.
So you're just basically extending that time that you have to reduce the injury or the severity of the injury, basically?
Absolutely. That is our goal. That's our number one goal, is to fight trauma globally at the scene all the way into the hospital, so that we're slowing down the processes and giving the patient a better chance of a better outcome. So it's really all about potential. This is just a portable little device here, huh? Yes, this is a portable device. Basically, you can set the temperature where you want it for the patient. You can set it down to 40 degrees. You can set it to all the way up to 105. So the circulation of the water inside the system can slow down the actual trauma that the patient is going through. And so this is what our product does. And basically, this goes over the carotid arteries of the patient, over the top of the neck, just like a cervical collar would. So there's your cervical collar type system, and we have a system that will immobilize the patient at the same time. Then this goes over the top of the head of the patient and Velcros right there, so the patient's head is this way. Is that what this is right over here? That's exactly what that is, but this one has hoses that come out the front. That's a carrying bag, so it can be mobile. You can take it to the patient. So if a patient is having a heat stroke or something that they're away from the ambulance, you can carry this bag. It's battery packed, and take it actually to the patient. So we've been promoting this and just now introducing it into the market. Any problems with getting a patient too cold or too warm, and how do they know what temperature they basically need to use? The same as the protocols that are coming out now is just doing the temperature measurement through the ear, also doing a oral temperature measurement. And so we're just monitoring the patient's temperature, which we already have to check vitals anyway in the ambulance, in the hospital, all the way through the continuum of care, every 5 to 10 minutes whenever we're bringing a patient in, and in the hospital during that critical golden hour. So we're already checking all those things. So what we're trying to do is just slow down the trauma to give that patient a better chance, give doctors more time to operate, so that we don't have a wait and see attitude in these traumatic situations.
I know a lot of people have been talking about the football player who was injured here, Everett, and that they got the icy IV solution into his body and brought his temperature down. Is this something that's similar in conjunction with that? Very similar, and we will be in conjunction with the cooling IV. Of course, we're excited that we see outcomes with any patient, and it just brings a great big smile to my face, of course, when you hear of a spinal cord injury like that, where a patient is having cold therapy applied, and their recovery is, you can see the difference between where recovery has been over the years and how
major trauma to a spinal cord like that, over a time, really the swelling begins to break down and stretch that spinal cord even further. And so what cooling does will keep that from occurring, keep that swelling from extending that damage, that secondary trauma that occurs to the patient. So that's really what is so exciting about applying cold therapy from the scene on in. So we have a product that's non-invasive. It's a surface cooling product that any paramedic can use. Any grandma has used it, on their children with a fever or anything else.
Right.
Just a basic technology that we're trying to simplify and continue in our research, and we're encouraging others to come and help us, and encouraging other physicians to come and help us so that we can continue making a difference in the lives of people.
Well, fantastic. Well, sounds like some new protocols are probably on the horizon, and going to be a benefit to everybody out there.
Yes.
Thanks so much. I appreciate it.
Thank you very much. Thanks.